Hello, Mr. Boris. How are you?
I'm good. How are you?
I'm good. I'm Dr. Wright. I'm the pharmacist here, and I'm going to just be discussing your type 2 diabetes with you today. Okay?
All right.
All right. So, I see here in your charts that you've actually been diagnosed with type 2 diabetes for at least 14 years. So I'm just going to reiterate what it is, and we're just going to go from there. Okay?
All right.
So type 2 diabetes is when the insulin in your body doesn't control your blood sugars properly. So it causes an increase in the amount of sugar in your blood. Okay? Okay. So we're going to discuss some of your risk factors for your diabetes. Okay? So the four main ones that I want to point out to you is going to be your weight, it's going to be physical activity, your hypertension, and your high cholesterol. Okay? So firstly, you are labeled currently as obese. You are 289 pounds. You're 5'11". So for your height, you should actually be around 133 to 179 pounds. So reducing your weight will definitely help with your diabetes because it's a very big risk factor right now. But your hypertension and your cholesterol are also uncontrolled at the moment, and getting those under control will help with your uncontrolled diabetes. I said earlier, you are labeled as obese, and decreasing your weight can definitely help with your diabetes management. So a big way to do that is exercising. So do you think that you right now are any sort of physically active?
Oh, no.
No? Well, I can tell you something that will, help get you motivated. Honestly, right now, all you need to do is at least 20 minutes a day of moderate exercise. And that could be anything from walking your dog that you told me about, from riding a bike, from just walking around the block by yourself, get some fresh air, even water aerobics. I don't know if you're into swimming, but if you are, water aerobics is also an option. And just 20 minutes a day, and boom, it gets your heart rate, your heartbeat going faster, and will definitely help decrease your weight. Okay?
Okay.
All right. Another way to help reduce your weight is going to be your diet. How do you think your diet is right now currently?
Well, I'm over 200 pounds.
Okay, so something that I recommend, the ketogenic diet. The ketogenic diet encourages high fatty foods like eggs, protein, broccoli, and it's going to limit your carb intake. Carbs could be anything from starchy foods such as potatoes or corn, and also your sugars, your table sugar, if you like Kool-Aid, all that. You're going to have to, cut that down with the ketogenic diet. But it does have a high rate of weight loss. So it's a win-win right now, and I'm not asking you to cut out what you're doing cold turkey, but gradually, so it won't seem like it's all too overwhelming for you.
Right.
Okay? All right. So can you give me an example of something that is part of the ketogenic diet that you can't have?
Starch.
What's an example of a starch that I gave?
Potatoes.
Great job, Mr. Boris. You're gonna do great. Okay, so now that we have, the exercise and the diet out of the way, let's talk about your smoking. I see that, it's been getting more intense, like your smoking wise, over the past couple of years. Have you ever thought about quitting?
Not since my wife left.
Okay, and I'm really sorry, about your wife. I would like to, discuss maybe your options of quitting, because smoking can definitely enhance your diabetes, even your hypertension, your cholesterol. So, if you want, if you think that you're 100% ready to take that next step into transitioning to quit, there are some different support groups. There's even a telephone line where you can call in. You can do it from the comfort of your own home. You can call in and take that next step. Take it day by day, you know? I think it would really help your diabetes management as well. Okay, so now that we got, all the physical activity and diet, smoking out of the way, we're going to discuss your medications, okay? All right, so I see that your doctor wants to start you on a basal bolus insulin therapy. Is that correct?
Yes.
Okay, and I know that you had some concerns about it due to past experiences with your mom.
Of course I do.
Okay, I definitely understand how that can be difficult, and I totally hear what you're saying. But with your with your glucose and A1C levels for your diabetes at the moment, they are extremely high. And honestly, when they get to this level, we normally initiate insulin, because insulin is the only diabetes medication that can 100% lower your A1C by a significant amount and definitely help you get all of your levels under control. So your diabetes will be under control. Is this making sense so far?
Very much so.
Okay, so, and honestly, you don't have to take it forever. You have type 2 diabetes, and most people don't have to take insulin, but once you get your levels under control, you'll be able to discontinue it. You won't have to worry about it anymore. Some side effects that I do want to let you know about with this insulin is that you could experience weight gain. That's one of the main side effects, and I know that we're trying to work on your...
That's more weight.
Exactly. And I know we're trying to, work on yours. So you really have to try and get into this ketogenic diet and your 20 minutes a day to try and at least, help balance out the weight gain that you could experience from taking this insulin. You could also experience injection site reactions, which just means you can get some swelling or some itching, redness in the site of where you inject yourself.
Mm-hmm.
But don't worry about that. That's not that bad, and it'll go away. And you can also experience hypoglycemia, which is low blood sugar. So you just have to look out for that. Make sure you track your blood sugar regularly. Make sure it's not too high. Make sure it's not too low. Everything is good. That way, if it's not, go to the ER or come in, see your doctor, and you'll be taken care of.
Okay.
So the basal bolus insulin that we're going to put you on is, we're going to start you on List Pro, 4 units a day, and then we're going to up the dose twice weekly, okay, and see how that goes, if it helps manage and get everything in normal levels. And your other part of the insulin is going to be Lantus, 26 units a day, and same thing, we're going to up the dose as needed, 2 to 3 days, every 2 to 3 days, okay?
Okay.
All right, and then discussing your other medications that you're taking for your diabetes, you're going to continue taking your metformin, okay? Don't stop, just keep taking it as directed by your doctor. You're also going to continue taking your Ferixa. You're also going to keep taking your Victoza as well. So your metformin, your Ferixa, and your Victoza, just continue taking those as directed, as well as your insulin. The one drug that we're going to discontinue for now is your Invokana. That's also, a diabetes medication, but it can increase your cholesterol levels. And right now your cholesterol is uncontrolled. So for the moment, we are going to discontinue that, try and get your levels back under control. And if your Invokana is needed again, then we will restart. Also, looking at your drug list here, I don't even see a cholesterol medication for you. So what we're gonna do is start you on atorvastatin, 40 milligrams, and you're gonna just take that, and that should definitely help decrease your cholesterol levels and get that under control. Okay, so how do you feel about everything we just talked about medication-wise?
I feel like I got an understanding of my regular schedule and what I have to do and what I should stop doing.
Okay, that's great. I'm so glad. Okay, so do you have any questions for me, Mr. Boris?
No, I think I got an understanding of it.
Okay, check back in with your doctor in 3 months so we can reassess you and see how the treatment is working so far, if we need to change anything. Just make sure you know that you're going on the right track, okay?
All right, Doc.
All right, so thank you so much for coming in.